Hello, everyone. My name is Darlene Nguyen. I am an internal medicine resident at the Wayne State University School of Medicine Internal Medicine Program. Today, I will be speaking to you about our QI initiative on improving management of type 2 diabetes mellitus in a resident clinic. Type 2 diabetes mellitus affects around 11% of the U.S. population and is the seventh leading cause of death. The latest guidelines from the American Diabetes Association advocate for the use of GLP-1 receptor agonists to improve both cardiovascular and renal outcomes, particularly in patients with concurrent chronic kidney disease or coronary artery disease. However, despite their established benefits, the utilization of GLP-1 receptor agonists in our resident clinic has remained suboptimal. The aim of this project is to increase GLP-1 receptor agonist therapy initiation among eligible patients with type 2 diabetes by 50% within 1 year through enhanced interventions in PDSA Cycle 2. A root cause analysis was performed to address suboptimal use of GLP-1 receptor agonists. It revealed a limited understanding of the benefits of GLP-1 receptor agonists or exposure to prescribing guidelines, an absence of clear clinical guidelines or standardized protocols for prescribing GLP-1 receptor agonists, limited time during patient consultations to discuss GLP-1 receptor agonists and other options, high out-of-pocket costs, insurance limitations, or formulary restrictions for GLP-1 receptor agonists, absence of clear guidelines or benchmarks to measure the success of GLP-1 receptor agonist therapy, patient preference for oral medications over injectable GLP-1 receptor agonists, anxiety or discomfort associated with injections leading to poor patient adherence, lack of patient education on the advantage of GLP-1 receptor agonists for cardiovascular and renal outcomes. Using the IHI Model for Improvement, a quality improvement project was initiated and guided by the Plan Do Study Act framework. Efforts were mainly focused on educating residents about GLP-1 receptor agonist benefits and eligibility, reviewing patient charts, and initiating discussions with patients. In our first PDSA cycle, a brief education session was conducted for residents and patient charts were reviewed over 2 months. Among 46 eligible patients, 32% had documented discussions about GLP-1 receptor agonists, and 19% initiated therapy. Approximately 33% had no documentation of GLP-1 receptor agonist discussions. Identified barriers included limited resident familiarity with prescribing workflows, patient concerns about costs and side effects, and lack of standardized documentation. In our second PDSA cycle, an enhanced education was planned to be provided to residents with an end goal to increase GLP-1 receptor agonist use in the increasing type 2 diabetes population of our clinic. Among 86 type 2 diabetes eligible patients, 3% were on GLP-1 receptor agonists. Barriers include limited time during clinic visits and high medication costs. Interventions included in this cycle are enhancing resident training through an in-depth workshop covering eligibility criteria, contraindications, dosing, titration, and cost-saving programs, supplemented by a quick reference guide. Patient-centered support involving developing an educational handout explaining GLP-1 receptor agonist benefits, side effects, and cost options will also be incorporated. A standardized documentation template will be implemented in the EMR, featuring an eligibility checklist and a follow-up plan. Additionally, a follow-up workflow will include an EMR-based tracker with reminders to ensure follow-up visits occur within 4 weeks of therapy initiation. We hope to build on patient understanding of therapy benefits, leading to higher acceptance rates and improving residents' confidence in prescribing GLP-1 receptor agonist therapy. Increased documentation and follow-up adherence, ensuring more patients achieve recommended treatment goals, is also expected. PDSA Cycle 2 builds on the foundation of Cycle 1 by addressing identified barriers through enhanced education, documentation standardization, and patient support. The ultimate goal is to improve type 2 diabetes management in our resident clinic, aligning patient care with the American Diabetes Association recommendations and achieving better outcomes for high-risk populations. Thank you.